I was coming in for an interview and I didn't know my way around very well, and I went to what I thought was the main entrance, but of course it was the Main Street entrance, and I was a little lost. And for those of you who know me, maybe running just a little behind of where I would like to have been. And I came in and I was a little bit unsure, and right away a volunteer could see that I needed a little help. They asked me what I needed. I told them. They said, oh, we know right where that is and we can take you down there. And it was kind of like, for me, a different kind of stress than our patients have, but nevertheless, an important day. And it was just reassuring to have that help.
You can be having a down day and you walk out and you see that volunteer escorting that patient to where they need to go, smiling, trying to help them understand. It just makes your day. I don't get a lot of patient contact anymore in my position, so when I get some time with a patient and I get to work with the volunteers in doing that, it's just a fabulous thing.
Thank you, volunteers, for all that you do.
The people that we have in our Fit Assist program could not be here unless they had a volunteer, a helper, somebody that assisted them with setup of machines, writing things down in their folder, managing all of the things that they do in exercise. So it would be really almost impossible for that person to be active on our machines and exercise if they didn't have that volunteer helping them.
Thank you, volunteers.
Part of my role in recruiting physicians along with the rest of the recruiting team, at least 4 of our most recent physicians came back and they volunteered when they were undergraduates at KU, spent time in our emergency department, spent time as transporters, and it's really fun to bring them back as a physician knowing that their start at LMH was in the volunteer department.
Volunteers are my heart. We have a volunteer up on our unit that I'm absolutely in love with. She does an amazing job. She's a retired OR nurse, and we couldn't do it without her some days. So she definitely makes a difference for us.
Thank you, volunteers.
For me right now, I enjoy our volunteer nurses because they give a different perspective on things. They talk about how their practice was when they were practicing as nurses, and I think that gives us a different perspective on how we practice now. So they're fun to learn from, and they're willing to jump in and do anything and everything that we need them to do.
Thank you, volunteers.
Thank you, volunteers, for all you do for us.
Sometimes they take care of us too, and they can tell when it's been a bad day or when we've had a difficult time. Their interactions are supportive. They're here, they're smiling, they're filling the paper in the Xerox machines. They're taking people down to X-ray and back, and they always do it with a smile, and it's uplifting. They don't seem to get as tired as we do.
They do everything, the little extra things that need to get done, but in your day-to-day work hour, there really isn't enough time.
I mean, they do hundreds of jobs, thousands of hours of service in our organization that help extend us as employees and act as, our third and fourth hand and another set of eyes and another reassuring person who can maybe see if a patient needs something or if a family's concerned or if they need to help find their way.
My mother was here as a patient, and she was going down to radiation oncology. The diagnosis wasn't really good, and so they called for an escort to take her down, and Alan came in. Alan has been a longtime friend of our family, and he wheeled us down to oncology crying all the way. It was such a sweet moment, such a sweet moment, and it hit me that that's our volunteers. They're us, they're a part of us, they're part of our community and very much a part of LMH life.
It's hometown and home to them, and I'd like to think, and I sure hope, that they know how much they're appreciated when they're here.
If there's anything I'd like to say, it's thank you, volunteers, for everything you do.
So I probably will get in trouble for singling out one person because I know quite a few wonderful volunteers. But I think about Shirley, and I won't use her last name. At one point when I started, Shirley was in the breast center with me, and then also in oncology, and now in Mario's closet. Particularly the work that she's done in supporting those services have been pretty amazing.
Every Wednesday or Thursday, and that is I come around the corner and John is sitting out front, and he is smiling and he's there to help transport patients, but he also wants to have a conversation, and he's a good ambassador to us, and he's a reminder to me of not only how volunteers give to us, but how we create an environment where volunteers can give back to their community and have a sense of, enjoyment and fulfillment and purpose. And I love that about our volunteer service.
I love them. I love them. Over 18 years, it's really fun to see the same faces and make it a point to introduce myself and talk about their families and talk about the work that they do here. So we're just so fortunate to have this group.
Thank you, volunteers.
I think the volunteers at LMH are really a reflection of Lawrence. I really feel like they have partnered with the hospital and they reflect the attitude of Lawrence.
I had the occasion to meet with a number of our volunteers and get some ideas around how do we do a better job with welcoming patients into our organization, with helping them find their way, even with finding our parking and working out, making it as easy as possible for visitors to come to us. And I was kind of going down one pathway along how I thought we could solve some wayfinding and access issues. And I had a couple of volunteers say, I really think we could think about this differently. And that's not a traditional example of how a volunteer impacts us, because usually they're there in a way that helps with maybe comforting a family or finding transportation or running an errand or doing something like that. But for me and my work as CEO, it was another set of eyes and another perspective on an important decision that helped me make a better one.
They're making a way for patients and visitors of Lawrence Memorial to be able to have a great experience when they come to Lawrence Memorial.
Their attitude, their teamwork, the way they care for patients, they're just amazing people, and we're grateful that they're here.
I probably can't say thank you enough, but for all of us here at the Oncology Center, from front office to nurses to the docs, to all the patients, to all of you volunteers, we say, and with all sincerity, the greatest thank you.